about it also. And there are my colleagues who probably might have joined the session. I don't know. So we are going to just brush up that, but brush up in a way that it gets aligned with our topic for today. Then we are going to talk about the hormone, the basics. What are hormones? What are the functions of these hormones that we are going to talk about today? Then we will be touching the topics that all of you are, expecting me to: the PCOS, the menopause and the perimenopause, and something about the thyroid health and natural ways to healing them, or probably to prevent them from getting bigger, picture in your life. And the role of homeopathy, of course, in balancing all of these hormonal health. So what is health? Let us begin with understanding, take a few moments to understand health. Health actually is not just the absence of disease, or it is not just the absence of infirmity. People, all of us take health for fitness, which is also not true. So if you revisit the WHO definition of health, I'll be little textbook wise here, because that is the most authentic source nowadays that we want to go and look up to. So I thought of taking this as our point of basics for today's discussion. Health is a state of complete physical, mental, and social well-being. The WHO itself says physical and mental together, along with social well-being, and not merely the absence of disease or infirmity. Now, this is a picture for those of you who can look into their screens. You can take a moment and look into the screens. If you're not on the phone, then might be possible that there are some circles described. In the center, there is this human being, and there is the innermost circle is that of mind, spirit, and body. And then there is the second circle closer to that is family. And then there are four circles surrounding that. One is personal behavior, and second is human biology below that. Then on the right side, there is psychosocial environment and physical environment. What we understand here is when we talk about disease, we always tend to look at the physical environment which is affecting us. People who come to us for the treatment of allergies, for example, they say, okay, we were having dusting and we were doing dusting for the Diwali. Nowadays, this is what people come and tell us, that because of all of dust here in India, there is a lot of dust. I'm sure you all are aware. So because of that, I'm getting these allergies and I'm catching cold, or I'm having rashes and all of that. Never ever do we ponder upon the other environment that WHO has given in here, the psychosocial environment. Okay, we must take a note of that, because that affects us. In what way, we will just see in a short time. Then the outer layer is community, human-made environment. It is not the nature-made environment. It is the human-made environment. What is that? The work environment. For children, that is the school environment, the social environment that we are talking about, and all of that, they keep going on. And then there is culture. Then nowadays, there is social media and all of that. And then there is biosphere, where all the other living creatures, they also interact with us. So we understand that there is flu, then there is bovine flu, which is coming from the birds or the poultry. But that is the outermost circle. It is not very immediate to us, which means that it is not immediately affecting us. All the inner circles are more important, and they affect us most immediately. That is one eye opener that we should carry forth while we are thinking about any disease or why we came down with a disease. Okay. So moving on, what we understand with health according to homeopathic perspective is true health is complete harmony, where the spirit, mind, and body work as one. And there is something like we are aware of this term immune system. But when we talk in homeopathic terms, we talk about that one, we in our Indian language, we call it Atma. So something within us that flows freely through all systems is what we call in homeopathy as vital force. And what it does is it coordinates in a perfect harmony all the organs and their functions. It does not happen so that the heart is pumping and the lungs just fail to function during that time. No, everything is going on synchronously at the same time in the same human body, which we are not even aware in a healthy state of mind, so that we are able to use our reasoning, our gifted mind. We are the most evolved of the beings on the planet. And we are able to use this reason gifted mind perfectly for the higher purpose for which we are born. And therefore, we are able to do all these discoveries and all. Now, imagine Einstein coming down with flu every now and then, or anything like that. Will he be able to use his reason gifted mind for the higher purpose of his existence, that was his scientific inventions and discoveries? He wouldn't. We can relate to that in our day-to-day lives also. That is why in homeopathy, what we believe is health is not merely the absence of disease. And therefore, we investigate into how the person is feeling when he is having any of even a viral infection or a bacterial infection also. Now, when we understand health, is the time that we want to understand the perspective of disease. What is disease? So there are two views. One is the modern medicine view, and one is the homeopathic view again. So modern medicine view, as I already said, we think that disease is caused due to a virus, a bacteria, or a dust particle, or anything outside. It is like a foreign entity, and it just has inflicted upon us. And therefore, what they do is they give something to go against that agent, that foreign entity. For example, antiviral drugs, anti-malarial drugs, anti-inflammatory drugs, antibacterials, or anything that quick fixes this agent that they think has caused disease. Okay, this is one view. And the other view is that disease simply means you are not at ease. We saw what health means: perfect ease and harmony. And disease is something that takes you away from that ease and mental peace and harmony, and that all those functions inside you which go harmoniously and you don't really need to think about them. They are very effortless within you. But when something is wrong, then you feel diseased. It might not so happen that you even know the name of that disease, but that still means you have a disease. Okay. Now, there is one more, what I say is a dimension to understanding a disease or understanding health. That is one revolutionary step. And now in homeopathy, what we do is we integrate these insights to understand the person better and to treat them better, because we need to understand and treat the root cause. So what we understand as the root cause now further is a metaphysical insight. Now, metaphysics is a science. You can even Google it up. That doesn't matter. But in short, it is a science which relates the cause to effect. The cause could be anywhere. It could be beyond what we see. And the effect is what we see in. So it relates the mind to the matter in nature. Details we will go later if somebody really needs to know about it. But for now, you can just understand this. Based upon that, there is this revolutionary understanding by C.G. Jung, who is also a psychoanalyst, and he's a psychologist, that the human being has only one disease, which is the loss of harmony in consciousness. Now, what does consciousness mean? I think all of us understand that you are conscious of something going around you and you are perfectly okay with it. But if there is a loss of harmony in that consciousness, for example, you want to go and watch a movie, or you want to go and watch a webinar like you're doing now, and you're conscious of it. But in your mind, you are not perfectly here. You're not 100%, or you're not sure if you want to be here. So in a way, your harmony about your consciousness of wanting to do one thing is not there. There is disharmony. there is disharmony. Everything is not aligned to this purpose of your consciousness as of now. Okay, that's a small example. So what happens is, when a person refuses to consciously assume that a part of himself or herself, its shadow, that is rejected by it, okay, and this rejected thing manifests as a symptom. So imagine, this is a very small example that I gave, but if this happens with you day in and day out, you want to do something consciously and you are probably doing it also, but you are not there 100%. What happens is, there is a conflict within your conscious, and that conflict within your conscious gives a rise to disharmony, and that is the deepest cause from where the illnesses begin, where the body becomes the mirror of the soul. And I think, coming from a religious background, most of us, all of us who believe in some or the other religion, they have this aspect of something higher than the body, which is the soul. And the body functions according to how our soul takes shape. Imagine that soul being in a conflict for a long time. I will say, it doesn't take very long. Even the accidents that happen with you, you're walking, you're walking the same path as you walk every day. But why do you have to trip today? Why does your ankle sprain today? You need to think about it. What were you thinking at that time? And there is a metaphysics to that as well. We will do that some other point of time. So now again, some of you might not want to believe in what I just said, and therefore we come back to the matter again. From the mind, we again come back to the matter and try and understand things scientifically, because what we understand by science is what we can see and believe and see the effect. That's okay, perfectly okay. So let me try and make you understand something more scientifically, which is by the PNEI axis. And the reference is PubMed, which is a very go-to site for the medical professionals. The PNEI axis is nothing but psycho, neuro, endocrino, immunological axis. And this study is the study of the intimate relationship between immune system, the physical, the emotional and psychological aspects, the states of consciousness, and chemical mediations to demonstrate their physiochemical interdependence, which means it talks about thoughts and emotions, nervous system responses to thoughts and emotions, hormonal communications, how that happens, what the mind thinks and what the mind feels, that is conveyed to the endocrinal system. The hormones are then released, and these hormones communicate via blood to all the other parts of the body, to all the organs. And similarly, it communicates to the immune system of the body. And then the immune system triggers a response. It could be an over response, it could be an under response, and that is how the immune system fails, or it overreacts. And therefore, there are allergies. And if it overreacts in a very bad form and it goes against its own body cells, it is called autoimmune diseases. That is how the entire picture changes from health to disease. Again, this is a small example. Excuse me, I'm just having a sore throat today. This is a small example of how, a very palatable example of how, if you are undergoing stress for a long period of time, for example, you are having a major depression or anxieties and panic attacks, and if that keeps happening for a long period of time, then what happens to the cardiovascular system? You come down with a cardiovascular disease. It is not due to lipids, it is not due to cholesterol, because what happens with lipids and cholesterol is that sometimes they find under the lab that these are good cholesterol or these are bad cholesterol. Oh, this cholesterol are not bad. They are needed for our body. They are needed for the health of the cardiovascular system. This is what keeps happening under the labs by the scientists, none of their faults. But because they are targeting only at the physical levels and not seeing behind the cause, The lipids and the cholesterol are also an effect of stress. Okay. Coming back to today's topic of interest, which is our hormones and the hormonal health. What are hormones? So, you must have known hormones are chemical messengers and they cause a lot of things in the body, but they don't cause a lot of things in the body. They are the chemical messengers without which we cannot function at all. They are chemical coordinators of the body functions. Their messages travel through the bloodstream and signal all the organs to function in proper harmony. They are essential for optimal health and for life and for something called as homeostasis, that is the internal balance. Homeostasis means the internal environment, the environment within one's body and mind, which is optimal for our survival and for our healthy existence. Okay. So when we talk about a woman's life, that is the reproductive life of a woman, right from the menarche, when they attain the periods, to the menopause and further also, then there are these female hormones that are responsible. The FSH, the LH, the estrogen, the progesterone, and all of these happen. There is an increase and decrease of these hormones at various phases of the menstrual cycle. Excuse me. So instead of going into great details, I will talk about an ideal menstrual cycle, which is for 28 days. The middle of the menstrual cycle is the ovulation, that is at the 14th day here. And there are different phases. First 14 days are called follicular phase, and the last 14 days are called ovulatory phase, the luteal phase, okay? Not the ovulatory phase. The follicular phase sees a rise of hormones like FSH, and later in the middle, all the hormones rise. The FSH, LH, the estrogen, and the progesterone rises in the later half of the cycle. FSH is the hormone which is responsible for forming the oocyte, that is the egg, which is released during ovulation, which is then fertilized if there is intercourse during that period of time. And then if it fertilizes, then there is sustained release of progesterone during the later half of the cycle, so that pregnancy remains and there are no periods. But if it does not fertilize, then in the second half of the cycle, the progesterone, LH, all of them decrease gradually, and then we get the next cycle. That is how a normal menstruation takes place. So the things that go behind it, a little bit behind it, which are responsible for the release of all these hormones are the hypothalamus, which releases the GnRH, that is the gonadotropin releasing hormone, which is a hormone responsible for the secretion of FSH and LH. Then the pituitary gland also produces FSH and LH because of the secretion of GnRH. And the ovaries are responsible for production of estrogen, progesterone. Estrogen in a female to a great extent comes from ovaries. And that is how, this is the dance of hormones in a woman's life. This is a normal cycle. And then there is some role of these hormones in our reproduction life, like FSH, LH responsible for formation of egg and ovulation, whereas estrogen and progesterone are responsible for preparing the endometrium for pregnancy. In puberty, estrogen and progesterone are responsible for developing secondary sexual characters. But there are non-reproductive role of estrogen as well, like maintaining the cholesterol levels, the blood sugar levels, bone and muscle mass, circulation and blood flow, collagen production, and moisturizing your skin, brain function, including ability to focus. Now, estrogen has a lot of role, and that is why when we see the decrease of estrogen, then all of these goes for a toss. For example, the cholesterol can cause heart problems in menopausal women. The diabetes also is seen to start during this period. Then we are very, very well aware of the strength and muscle mass, the strength of the bone, the osteoporosis starts, the cardiovascular health is at a toss, the skin starts to shrivel, and there are a lot of melasma also because of the skin collagen that starts decreasing, and there is brain fog also. So the hormones are very important in a woman's life. So if you want to understand PCOS, first and foremost, because PCOS is something that affects many women in 30s. Nowadays, PCOS is more seen amongst the menarche age. In young girls, as soon as they start menstruating, but it is best to wait for a couple of years to diagnose this condition, because it takes a while for the hormonal cycles to establish before which we can diagnose. So there are something like a criteria for diagnosis PCOS, which is called the Rotterdam criteria, which is used nowadays. And out of these three criteria, 3 points, at least 2 points should match. One is there is hyperandrogenism, which is skin tags or acne or very oily skin, or there is male kind of hairy growth on the face, on the neckline, or the arms and the limbs, and there is a male kind of hairy pattern, which is a hard and coarse hair. Otherwise, there is often most peculiar is the irregular or absent cycles, or there is absence of cycles for months together. Or once the periods are established, suddenly the cycles stop coming for months together. Where on ultrasound, there could be multiple cysts visible in the ovaries. Now here in the figure, this is the healthy ovary, where one follicle has matured as much as that it can bring about ovulation, because the FSH secreted is in good amount. But in PCOS, what happens is that the FSH, which is a hormone responsible for ovulation, which is secreted from the anterior pituitary, it is insufficient. It is very less. Therefore, the LH is more, FSH is less, and then the follicles do not mature enough to be released for ovulation. And therefore, there are multiple small follicles, this middle size and small follicles seen in the cyst, the polycystic ovaries. This is how the diagnosis is established. Then the blood test is done to confirm the diagnosis, where the LH to FSH ratio is very high, which simply means that your FSH is produced is less, and you have absent cycles. And that's how you confirm the diagnosis of PCOS. So there is a significant rise in women with PCOS, especially at least in India. We see a lot of young women coming on with this problem. A lot of college going kids or a lot of kids in the high schools come with this problem a lot. I haven't yet seen PCOS in the 30s. It used to be earlier, as I said, but now, there is a shift in the age group. Yet, if you have any, absent cycles, first and foremost, in there is this fertility. You should take a pregnancy test, but after that, you should consider PCOS as well. So, what triggers PCOS? All of these: the refined food, processed foods, prolonged screen time, and sedentary behavior. There is less of activity. And there is this circadian rhythm. I forgot to mention here. The circadian rhythm is affected, the sleep cycles. And this in turn, it disrupts the endocrine system. And then there is chronic mental stress and pressure. We just talked about the PNEI axis. So now you can understand if there is this chronic mental stress at the emotional level, at the intellectual level, at the perceived level of your environment, then it affects the endocrine system in return. And there could be this kind of condition that comes up. And if it is not managed, it can lead to infertility in women. It can also lead to insulin resistance. And therefore, there is type 2 diabetes in PCOS women with obesity. And it could lead to cardiovascular problems. Now we take a step further, and this is a very important step. This is something that is my value addition to, to the topic, because this is not something that you will come to hear often. The mind-body connection. We talked about C.G. Jung's theory. We talked about metaphysics and the psychoanalytics and all of that. Based upon that, what we understand with PCOS is ovaries represent symbolically procreation. You have ovulation in the ovaries, which is procreation. If your ovaries don't procreate, you will not be able to give birth to a baby, and therefore there will not be motherhood. It is a creative life force. It is also responsible for the female hormones, the estrogen, majorly secreted from the ovaries. And therefore, it is responsible for your femininity. It is responsible for you to feel the femininity and the femininity that comes out of you, the reflection of femininity as well. So what could be the causes? If this is not happening, then what is happening? When PCOS typically develops, what happens is probably in your conscious mind, there are these conflicts going on. We talked about the conscious mind and its conflicts. What could be the conflicts at the conscious mind? Gender discrimination. If you are born in the typical Orthodox family, no matter what country it is, there used to be times when there used to be gender discrimination a lot. And when that happens, especially during menarche, and imagine that girl is just developing her periods, which distinguishes her from the male counterpart in the family, for example, her brother or somebody. And she's her her body starts showing up symptoms where she is laid down for a couple of days, or she's less strong during that time. And then she understands that, oh, my brother or whoever in the family is more competent during that period of time. Okay, they are more watchful for me and not for him. My freedom is hampered. Why can't I do certain things which he can do? There's a lot of gender discrimination happening. Then in careers, in offices where there's gender discrimination. And then probably in another situation where a girl feels that, I have to be answerable for everything that I do. So I don't want to be dependent. I want to be financially dependent. So she starts taking up more responsibility for her finances. Or there is a situation where she is the only responsible person in the family, and she has to actually take a lot of responsibilities. What she does is she is not able to take on the feminine role that is very natural to girls, or that is very natural to all of us. We like to be feminine. We like to enjoy our femininity so much. But imagine if we want to deny it, if we just want to achieve something in our life and we say, oh, shish, I don't have time for all of these right now. Then the mind starts signaling the endocrine system to suppress the ovarian function. Why? Because the ovaries are told that your femininity is not needed. The hormones that you're producing is not needed right now. And therefore, the whole imbalance begins. This is a way of understanding. This is a way of perceiving why a person who has genetic predisposition shows PCOS, whereas another person who has genetic predisposition does not come under the PCOS imbalance. Okay, so high career ambition, competing with biological nature, taking on traditionally the male responsibilities, fear of financial or emotional dependency. All these are the inner conflicts which we understand behind PCOS. And they compete directly with the male counterparts. and they suppress their natural feminine rhythms. Okay. So in our clinics also, there are many females, especially the younger ones. They're really unhappy with their periods coming on, and they really don't want to have their periods. That happens in girls around you know uh, 15, 16 years of age also. So we've discussed this all. Now there was a question: can PCOS be prevented? Or somebody asked if PCOS is curable, right? So now you need to understand and you need to ponder upon this. Is it curable? What do you think? Can you reverse it? If it has happened with you or with somebody who you know, can you reverse it? Of course, I think the answer should be yes. If you take an introspection and insight within yourself and try and understand in your conscious mind, what is the conflict going on? The conscious mind means when you're awake. The conscious mind does not mean what is on the surface. You might need to delve inside a bit. You might need to take a journey within to understand exactly what's going on in the conscious mind. And that's when we say that you need a me time. You need to sit and reflect within yourself. Okay. And that's where all your answers will come out. If you are able to resolve that conflict, either by yourself or by taking help from professionals, psychoanalysts, psychotherapists, hypnotherapists, whoever, or a homeopath. Doesn't matter. But yes, you can treat PCOS if that is happening. And to prevent PCOS in your girls, you already know that we have this as a solution. What is the conscious solution? Here they say conscious balance in life without compromising ambition. Understanding creates the foundation for true healing. So in homeopathy, what we do with PCOS is we take the deep case history to uncover these kind of root emotional causes, what that person is thinking, where it comes from. We take a journey into not just the symptoms of the disease, because they are all very common. Most of them, they are either categorized in 1, 2, or 3. We diagnose, perfect. The OBG sends them to us for treatment. They come to us for treatment. We understand it, and we are with them for the symptomatic relief as well. But here in such cases, relief will not come unless we dive inside the patient and try and understand the conflicts, the emotional conflicts, the conscious conflicts. And we do all of that in homeopathy. And then if you are on any kind of hormones, I almost always advise them to stop hormones. But by God's grace, people who come to me are off the hormones and then they are still not better. Therefore, they come to us. And what goes is definitely the effects of PCOS also, like the acne or the obesity, the weight, the insulin resistance, and the menstrual cycles are also restored very immediately. But we need to continue the treatment for some period of time because we are working at that emotional conflict, and that does not get fixed overnight. That takes time, which is why we think, oh, okay, homeopathy, it takes time. Nah, it's the disease that takes time. Moving on, let's take a look at menopause. Menopause is that one fine day wherein you have just lost your periods. And when you look back, you haven't had your periods for almost at least 1 year, one whole year, or 12 consecutive months. Okay. That can happen anytime nowadays. But still, there is a reference range which is 45 to 55 years. Before 45 years, it is called premature or early menopause. Premature ovarian failure is even before 40 years. And after 55 years, generally menopause stops. If it doesn't, then the bleeding keeps on increasing, and that is a sign of alarm. We will see that later. So there are 3 stages of menopause: perimenopause, menopause, and postmenopause. So this is okay. We'll just skip this. So perimenopause. Perimenopause, many times women, my friends, I belong to the age group of perimenopause. So many times, my friends and my girls, my colleagues, they keep asking me, Oh, this is happening, that is happening. Could I be perimenopausing? I say yes, of course. Why not? It could be 8 to 10 years before your actual menopause sets in. Ideally, it could be only 3 to 4 years, but still the margin is 8 to 10 years. It may begin as early as mid 30s if you're going to menopause at 45, or it can be very short. Lucky women have a very short transition period also. What is happening in menopause is the estrogen levels decline. Subsequently, the progesterone levels also start declining because the ovaries are not in a functional state, and therefore the progesterone has also has no reason why it should be, manufactured. So it also subsequently starts declining. The hormonal levels before declining, they fluctuate because sometimes it is like the signals are received for ovulation. Sometimes there is ovulation and therefore there is a lot of estrogen, or almost is a normal estrogen is manufactured, and the progesterone is also manufactured in the ovaries. But sometimes there is nothing at all, and therefore there is this roller coaster kind of journey that keeps happening in the menopause. Because of persistent levels of decline in estrogen, there is a high rise of FSH also. So everything is out for a toss. If there is a blood check done, then nothing can be taken as a hallmark during that period of time. So the first sign of perimenopause could be irregular periods, not hot flushes, irregular periods. For a person who is menstruating every month, particular date, very particular, will now notice some change in the pattern. Suddenly, there is after 21 days, or sometimes it is 35 days, but that is the new normal, and that's a first sign for perimenopause. Then there is this whole lot of symptoms during perimenopause. The most common symptom that perimenopausal women know about themselves is hot flushes and night sweats. There is some abdominal obesity or bloated feeling, and no matter what you do, it doesn't go down. That's okay, because there is muscle loss at the same time, there is water retention, and there is weight gain, and there is abdominal fat because of the muscle loss. Then definitely, as I said, as there is irregular periods, the periods can get heavier or they can get lighter also. Both is normal. Sometimes there could be slight discomfort. It could not be very painful periods. So if it is quite painful in a person who is having painless periods, if you suddenly start getting a lot of pain, then it is not perimenopausal. It could be something else also. You need to investigate. But there could be discomfort. There could be worse PMS. Now, if somebody who is not getting PMS during the period of, the period of menstrual age, and they start getting this PMS, then that is pretty normal because, as I said, sorry, I forgot to mention, PMS also is due to the lowering of estrogen and progesterone. In the last week of the menstrual cycle, all these hormones decline. Therefore, there is PMS, which is the same thing that happens in perimenopause. And then there is lower libido, lower sexual drive, and there is a lot of vaginal dryness and itching, which is why there is irritation during intercourse, or there is little pain during intercourse. Then there is dryness and itchiness of the skin, brittle hairs, brittle thin hair, facial hair. Then there is insomnia, night flushes, night sweats, sleep problems. There could be anxiety. There could be brain fog. There could be depression, mood swings, lack of motivation. You don't feel like waking up in the morning. Suddenly you realize that your routine has changed. You have to push yourself to work. You have to push yourself to exercise. You don't feel like talking to someone in the morning. That's perfectly normal. It's perimenopausal. What is more distressing could be somatic symptoms, that is, a physical symptoms like headaches, migraine, fatigue, body aches, dizziness. I've had friends who had joint pains also. Your muscle and bone density reduces, which causes little arthritic-like symptoms. And there are pins and needle sensation, which also come up. So menopausal symptoms are almost always the similar, but there is an addition. There is the vaginal dryness persists. And therefore there is more sexual discomfort, or there could be little spotting also. And there could be a lot of recurrent UTIs, and there will be urinary urgency. Before UTI, what happens is there is normal urinary urgency seen in menopausal women. So they are always on an alarm whether I should get my urine tested for infection. And I would not say no, they should get it tested, because it's very common in menopausal women to get frequent urinary infections. There are, as we discussed, the estrogen has a role in other body parts also, and therefore uh, postmenopausal women also get the symptoms of racing heart, headaches, joint muscle aches and pains, arthritis, difficulty concentrating, weight gain, hair loss, and thinning. What are the red flags? When could you seek professional help? For menopause, for perimenopause, you need not seek any professional help. There is no investigation that is needed. You understand when it is coming. But there are some red flags. For example, you get suddenly, it should be declining, the period should be declining, but suddenly, while that is declining, you get heavy periods with large blood clots. uh, or the periods keep lasting significantly longer than usual, more than 8 days, more than a week. Or you have had menopause and suddenly you start bleeding, okay? Or you bleed after sexual intercourse. Or during perimenopause, your cycles are less than 21 days apart. Then that is not normal, and you need to investigate further to understand if it is perimenopause only or it is something else. You can seek help also when your symptoms are distressing, disrupting your life, and definitely when your depression or your anxiety issues are not, manageable by your own self. Your quite, quality of life is something that is important. So typically, people, I've often met friends who think that their menopause needs to be examined by blood test, which is so not true. But yet, if you do the blood test, then typically there is rise in the FSH levels and there is significant decrease in the estrogen levels, which we already discussed. Then when you go for blood test, your doctor might also want to rule out the thyroid dysfunction, because that is also very common during this age group. And we will learn about that in some time. So there's something to introduce when you're menopausing. A lot of nourishment. Nourish your soul, your body, your mind. Nourish with natural hormones. Now, I'm not going to talk about hormone replacement therapy, because that is between your OBG and yourself to take a call. What we will discuss today is something more natural. There are some food which release, which help in the production of these hormones to certain level. It can definitely not replace the ovaries, and that is not needed, which is why nature decided to give this menopause kind of thing to us women. But if you introduce these foods in your diet, then probably the small level of estrogen or the hormones that it will give might help you function to a good extent. There are zinc-rich foods which produce hormones, like beef, jelly, shellfish, cashews, chickpeas, lentils, and eggs. If I'm going to read all of these, then you're not going to remember them. What I will do is I will just share them on the group after the webinar, maybe in a day or two. I will talk more about the lifestyle that the menopausal women must adapt, because what we see around is the kind of depression, lethargy, and weakness, and all of that, lack of motivation that menopause brings in, puts us off guard, and we don't really push ourselves from that, and we don't really look into the activity part, which is the most important in the menopausal women. We should do weight bearing exercises. If you have not done weights, lifting weights, you should start with small weights or you should exercise using body weights. Weight training should be done. The core strengthening should be done to maintain muscle mass, because until now the muscle was made by the estrogen. Now the estrogen has gone for a it's gone away from your life. You need to maintain the muscle mass by different means. So eat a lot of protein, eat a lot of things that will give you muscle mass, and then you have to build that muscle mass by exercising. You have to increase the resistance amongst your joints as well. So a lot of joint exercises also need to do. There's something called NEAT, that is non-exercise activity thermogenesis. What is NEAT? Is you it's not that hour which you dedicate for exercise or walking. It is that kind of activity which you do apart from your dedicated hour of exercise. For example, you have at least a 1 BHK or 2 BHK. If you have a house, that's great. But if you even have just your chair is at one corner of the house, then you get up from your chair every hour and go to the kitchen, fetch yourself a cup of a glass of water, do something. Just get up and do some exercise, which is not the dedicated exercise hour. And that is called non-exercise activity thermogenesis, because that produces a lot of it activates the metabolism by production of ATP molecules. So let's not go there, but it helps you keep your metabolism on toes. Then there are some mind-body practices like meditation. The best time to meditate is in the afternoon, 1 to 4 p.m. Why? Because that is the circadian rhythm, how the body releases hormones. So afternoon is the time when you are having the lowest, or the hormones are the lowest apart from the midnight. So afternoon, when the hormones are lowest, that is the time when you are really low on energy, which is the time when you meditate. Okay, and so that you can again boost your PNEI system and it gets ready after that. Then there are self-awareness practices like journaling. You must have heard about it. Breathing exercises. But you should sleep efficient. I mean, you should have a sound sleep of at least 7 to 8 hours. The circadian rhythm says you should sleep in the same time every day. Like, not like on Saturdays you sleep at 12 or 1, and on Sundays and Mondays you sleep at 9. That doesn't really make sense. You need to have an average of 7 hours at the same time almost. Avoid tobacco and avoid alcohol if possible. In homeopathy, what we do again is we try and understand what happens in menopause actually. When women seek help from us, it is because of some of their distressing symptoms, like what I said, some symptoms which are really digressing their life, and they want help with. Now there we take that symptom and we understand why this symptom only is the worst, or why only this system is not manageable. So there is some kind of conflict surrounding that particular symptom. For example, if there is a insulin resistance during menopause, or there is a heart problem during menopause, then why heart? Only heart. No other organ is affected, which means we have to understand the conflict that goes behind causing the heart problem. And that's what we understand when we take the homeopathic case. And that's how we suggest we suggest the homeopathic remedies. And we not only deal with that particular issue, but again, there is a balance maintained, which is a normal balance for a menopausal women. Now let us come to the thyroid gland. Thyroid gland is this butterfly-shaped gland in front of your throat. It has a very pivotal function in the body. The metabolism regulation, that is the energy that we receive from the body, is largely because of the function of the thyroid gland, which releases the thyroid hormones. Then control of body temperature, heart rate, growth and development of the body also is due to thyroid. And the thyroid releases these hormones called T3 and T4, which T3 is the active hormone and T4 is the storage hormone, which is used when the active hormone is little reduced. The common problems that we hear about thyroid are the hyperthyroidism, which is over-functioning of the gland, and there is hypothyroidism, which is under-functioning of the gland. When there is hypothyroidism, what we see is there is a lot of fatigue, weight gain, sensitivity to cold, there is hair loss, and dry skin, depression, brain fog, constipation, and slow digestion. The most common form of hypothyroidism that we see nowadays is the autoimmune kind of hypothyroidism called the Hashimoto's thyroiditis. In hyperthyroidism, which is the overactive gland, we see weight loss. The person is eating too much, yet there is weight loss. Not that there is no weight gain, there is weight loss. The heart rate is more, there is more anxiety without any rhyme or rhythm. There is heat intolerance. They feel excessively hot and sweaty. There are tremors, there are nervousness, and there's difficulty sleeping. And one common form of hyperthyroidism is Graves' disease. So how the demographic of thyroid disorders, who is affected the most? Women 5 to 10 times are more likely than their male counterparts, than men. The risk increases with age. Like I said, perimenopause, the diagnosis, when it has to be established for perimenopause, or you face some problem with perimenopause, then a doctor might want to check you for thyroid as well, because it is almost the similar age group. Then thyroid is also seen during pregnancies, and it is as common as 10.5%. In UK, there is high prevalence. Luckily, in UK, thyroid problems are not very common because of the water, the food, or whatever. So I think we'll skip this portion. Now, if we understand what thyroid represents, I quickly go into thyroid metaphysical understanding only, which is beyond the physical understanding. The thyroid represents body's biological clock, timing mechanisms. We discussed that if there is, the thyroid is responsible for the energy production. Now, this energy production also is according to the circadian rhythm, and that is what is meant by this. The thyroid is responsible for this kind of rhythm in the body, and therefore, in metaphysics also, it represents time mechanisms. It represents time and urgency and the conflicts regarding the pressures, the deadlines. There is personal power and metabolism, processing life, speed of processing, the mental and physical. The way you process life, the power with which you process life. Because thyroid is responsible largely for metabolism, and metabolism gives you power. So it represents the power in your emotional life as well. The common conflicts, therefore, surrounding thyroid could be that I can't keep up with everything. There is too much to do, and I'm not fast enough. I have to meet a lot of deadlines. I have a lot of pressure, and I'm not powerful enough. I can really not do what I want to do. Somebody is pushing me down. I'm not powerful enough to push them back. And they feel humiliated by circumstances because of that. Or there is more metaphysics to specific lobes, the right lobe of the thyroid and the left lobe of the thyroid also. And then the emotional patterns that we see in connection to thyroid could be fear of confrontation. They avoid action, imagine probably I talk about the Indian typical setups where there is a joint family, in I live in Bombay, and here I face a lot of these things. I don't know if it will relate to you, but for example, there is a joint family, and there is a mother-in-law and father-in-law and probably elder brother-in-law and half-sister, all of them living together. I really want to do something, but they don't want me to do it. What I do, I avoid confrontation, because I feel powerless to act on it. I feel powerless to act on urgent matters also. For example, they expect me to do something very urgently, but I feel no, 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 I don't have the ability to do it. Also, there is a conflict. Then they feel that their hands are tied up and they cannot act urgently. And then they feel that inside they feel that they want to fight, but they are helpless. So this kind of a conflict that keeps happening, it gives rise to thyroid disorders. So what we understand by thyroid disorder is we need to accept first, and then we need to do something to remove this. For hypothyroidism, what we can do is we can choose our needs over our wants. We can prioritize matters, we can prioritize ourselves. Then consciously we can slow down and we can resist urgency. We can honor our natural pace. We don't have to do things very fast. It's okay to do things slowly. And that way we can avoid hyperthyroidism conflicts in our conscious mind. For hypothyroidism, if we are aware, I'm hypothyroid, but if I am aware of my conflict, what next should I do is I should stop pleasing everyone. I should stop avoiding conflict, avoiding confrontations. If something is not happening right and I feel that I need to talk, I should talk. I should express myself. I should work at my own pace, and I should not feel guilty of not serving others also. Now, this is something that all of us expect me to talk, but I'm not a dietitian yet. From my perspective, what I'm trying to give you is some dietary support. Foundation principles should be definitely for anything, for all hormones, it should be minimized processed food, or don't eat processed foods. That's all. Don't eat refined sugar. For thyroid, especially autoimmune, you should go dairy and gluten free if it is autoimmune. I mean the thyroiditis. If not, then it's fine. But dairy is fine. Gluten is almost always an inflammatory thing, so avoid gluten. Avoid trans fats and industrial oils. Choose organic when possible, if you're really sure of that it is organic. The key nutrients for thyroids would be Brazil nuts, tuna, turkey, sea vegetables, fish, almonds, avocados, sesame seeds. So in general, almonds and seeds, we all are aware, the cashews, the avocados, the spinach, all of these, you should always have more and more in your diet. You can take supplements also, but the natural food is the best food. If you're not able to actually manage the natural food, or your appetite is not much, then you should go for supplementation for a brief period of time. Take supplementation, go on for 3 months, stop it, give it a break for 2-3 months, then again start it for 3 months. Okay, and if possible, before going on to supplements, whenever you can, probably if you travel to India, you can get the blood tested for these supplements before going for the supplements. The vitamin B12, the probiotics, that is gut thyroid axis, it will help the gut thyroid axis, the magnesium, the vitamin D, all of these are good suggested supplements. So lifestyle practices, as we talked about for the earlier menopause and perimenopause, also applies to thyroids. For thyroid, you should always avoid eating a lot of soy. So for vegetarians, what we do is we supplement our protein that otherwise we'll have from chicken and meat. We supplement it by soy, but excess soy is goitrogenic and we should avoid it. And there should be careful monitoring of the TSH, T3, T4, and you can also journal your symptoms if you want. So for thyroid, again, we have homeopathic treatment for thyroid, and it acts very well. So we try to understand what triggered it, the underlying conflicts again, try to have a comprehensive overview for the environmental stress or something in your workplace, something in your family. Is that a continuous stressor for you? And we try to draw your awareness to it so that you can manage it better. And we give you a constitutional remedy which restores your PNEI axis, because that's the only way homeopathy can be effective. And therefore, it supports the natural function. What happens is, if you take thyroid hormones, which everybody takes or which the doctors put you on, they advise you always that rest of your life you are supposed to live with the thyroid hormones, which is not so true. We just saw how the thyroid gets deranged, how the thyroid gets affected. So there can be a solution to it. And if you go for homeopathic treatment, then with the carefully selected homeopathic remedy that reaches the core of your conflict, we monitor your thyroid hormones every 3 months, and then gradually taper down your thyroid medications. And eventually there is a point over a period, depends upon your case, a period of months or a couple of years, that your thyroid external hormones can be stopped because your thyroid gland has started functioning and functioning normally. So here we come to the end of this session. There are these two questions which I would now like to address. One was about IUD that was asked in the group. I think somebody asked me that if you have inserted an IUD, then uh, how do you distinguish the bleeding with the perimenopausal symptoms? I think your question could have been partly answered by now because we discussed about the symptoms of perimenopause. The diagnosis of perimenopause starts from irregular periods and not less than 21 days. The cycle should not be less than 21 days. Now you insert an IUD and your cycles, you have noticed your cycles. There is a rhythm to that cycles. Now, if your cycles have shortened before 21 days, which means if there is in between, there is bleeding, it is definitely not perimenopausal. With IUD, if you have hormonal IUD placed, you have a lot of progesterone going, a sustained release progesterone, which keeps you from pregnancy. This progesterone is been there. So you are not going to have that kind of mood swings which perimenopausal women will have. There will not be a lot of fluctuations in the state of mind and emotions like perimenopausal women. Again, if IUD is there, then you will face problems like probably bad smelling vaginal discharge if that IUD has got infected or it has got inflammation in your parts. Then you will have this discharge, or you might also experience some kind of weird pain in your pelvic area. So which is a sign for your IUD to be checked again, and it will be quite distinguishable from the perimenopausal period. But the best way, take away from me here also, is please do not use things that are to be inserted inside you being a woman, because all these are hormonals and they affect the hormonal cycles in a bad way. Your OBG would not be able to tell you this or might not want to tell you this, but I'm telling you this. The best way for contraception or family planning is only use of condoms, the safest way for a woman. And please, if you use condoms, it is perfectly fine. You can make condoms a part of your what you call as foreplay. You need to be artistic and creative about it, but don't do anything that harms your body. That is completely not natural, no matter what they say. Okay. The second question that was about the diet, for the natural ways or the diet that you should be avoiding before and during periods for the menstrual cramps. So in short, this diet should not be something that is processed food. It should not be sugar, excess salt, or caffeine, because all of these will cause um, inflammation, enhance inflammation more, and there will be muscle contraction. The diet that you should include are a lot many diets: magnesium, calcium, zinc, and all of that. I'm going to share this in a nice template to you, probably immediately after this session, so you can take a look at it. So that's it. The key takeaways: hormones affect everything. They are powerful messengers. They are not just simply loose terms that we use here and there. Please be careful about it. Don't overuse, don't underestimate them as well. The root causes matter most. Address the underlying imbalances. The root cause is not limited to your physics, your physical body. You understand what the root cause really means, go down to the roots. Natural healing is possible. Your body wants wellness. You have the power to heal and take back the entire control, because it is you here who set the control loose. So you need to take back the control here, women. And so your next step should be begin lifestyle changes. Start it today. Lifestyle means the style with which you live your life. Lifestyle is again beyond sleeping on time, waking on time, eating on time, or being away from screen time. No, lifestyle means the way, the style, the attitude, the outlook towards life, and the conflicts and no conflict stage of consciousness. That means lifestyle, and start changing it today. Consider homeopathic consultation individual approach. Why? Because I'm saying this because even this picture, in many parts of the world, sadly, they are selling homeopathic remedies like a combination ones. Number this, 3, 4, 5 homeopathic medicines mixed together, and they're selling it over the counter. That is not homeopathy. That is Ayurvedic, allopathic, whatsopathic way of making homeopathic remedies, which could be sold and money minted. Because what happens is we are also used to quick fixes. We do not want to take out time to talk about what is actually taking us down, because it will take couple of hours. I don't have couple of hours for myself. What I will do, I have maybe 10 pounds or 20 pounds, and I'll go and just buy one because my friend recommended. And that's all that we care about ourselves. If that happens, we are not going anywhere, no matter what you eat, what you drink, and how much ever you exercise. Okay, so consider individual approach. Continue learning. Knowledge empowers healing. Trust your journey. Be patient with the process, because you don't know the process that brought you down. Now you should be aware of the process that will take you back to your normal harmony, and that will be probably shorter than the process that brought you down. The only thing is you are aware of this, you are not aware of that. And therefore, you need to be patient with this. You can connect with me for your personalized homeopathic care. And you have my number. And this is my website if you want. You can take a look at my website. It is by my name. I'll put it in the group. Thank you, everyone.